So for a new patient to just come into the office with a complaint of a joint or knee pain, typically we have a consultation to kind of get the whole history of it. Are there previous injuries? Is there previous surgery? Have they had imaging done anywhere else? Have they had injections done anywhere else? Kind of get that whole background, and then we kind of decide, do we need to go forward and do our own examination? That would be a requirement if we're doing any procedure in our office. Do we need any extra imaging, which we can order MRIs for our office. We shoot x-rays in-house here. Evaluation would tell us any like laxity of tendon ligaments around it, where the tenderness is, because any joint in the body is going to have several different potential structures to hit, areas to treat, arthritis to treat. So it would really kind of take several steps to determine where we need to be injecting and with what. So if they're a good candidate, it's kind of to determine what injection they would be best a candidate to receive. So if a person comes in with, say they have maybe meniscus pain, or they had an MRI and we see a small tear in a ligament or meniscus, or they are a young person with not a lot of arthritis, or even early stage arthritis, PRP is a really good option, platelet-rich plasma, which comes from your own blood. So as far as procedure goes, that requires a blood draw and then some processing steps to kind of spin, centrifuge down the blood to get out the growth factors, healing cells, which essentially are the same cells that go heal, say, a cut on your arm, that we can inject right to the source. We have people that come in with chronic joint pain, shoulder, knee, hip, anywhere that they maybe have an injury to from a past sports injury or something like that. We have athletes, we have CrossFitters that come in and they have even a more acute injury that they need treatment for. We have patients with chronic, they know about arthritis already. So depending on the complaint of the person, there's going to be something specific for that person.
Sometimes patients that are trying to choose between surgery or not.
Some people have already been recommended by an orthopedic to have a surgery, and they either maybe don't fit some of the requirements, like weight-wise or age-wise, or they have allergies to some of the medications they may use in surgery or something like that, and so either they're not a candidate to have that surgery that was recommended, or they don't want to have it. Plenty of patients have maybe a unilateral knee replacement and they don't want to have the second one done because that one didn't go as smoothly as they'd like it to, or they still have pain from that. So yeah, people that are kind of, or they're waiting, 50-year-olds that maybe need a knee replacement that would potentially need a second surgery at some point. So they'll want to push that off as long as possible.
And so how do people do?
How do people do?
Yeah, what kind of results do you get?
Mostly good. I mean, I don't have like an exact percentage point, but I'd say above 90% of our patients that have either the PRP or another regenerative procedure have decreased pain within 3 to 6 months, definitely better function. Some people notice earlier symptom improvement. Some people take a couple months to notice it, but most of them we've gotten back to pretty much normal activity for their age or whatever they were trying to accomplish by the third PRP shot or month 3, I would say.